You know, it's fortunate with us being in a convenient location. Certain people find us on social media, and we get to actually have the opportunity to treat them. Patient here is presented with low back pain, has previous care with chiropractic. Adjustments have improved him. He is getting some shooting pain into the right leg. Is that all the time, every day?
Left leg.
Is it left leg? Okay. Is it numbness, tingling, burning?
Just tingling sometimes.
Okay, and it goes into the glute as well. When is it worst? Is it when you're lifting, bending?
Just when I'm standing or sitting for too long.
Got you. And what is the main goal of getting this treatment? Is it holding you back from doing any activities or anything like that? Or
No,
you just want to have a pain-free day? Okay. We're going to do some muscle stems. It's going to help relax the muscles, okay? There's a muscle spasm setting. So it's actually going to work your muscle for 10 seconds and then let it go for 10 seconds. So it uses up all the stored energy so it can finally kind of relax, okay? That way, I'm gonna actually tie your legs and stretch, decompress your spine on this table, okay? Which is gonna help rehydrate your spine, especially being in the military, which again, thank you for your service, brother. I appreciate it.
Thank you for your support.
I'm sure you have a lot of heavy equipment and then a lot of strenuous stuff you've gone through for the back. So definitely we're gonna need to rehydrate it, okay? It's gonna bring in some of that fluid back in, increase mobility. Patient is complaining of headaches, so maybe come over here. Do you actually sleep on this shoulder? Is that what's going on? Okay, but can you compare left and right here? You can see this one is elevated more than the left, okay? Before we let him go at the end of treatment, I want you to compare. We're gonna adjust the lower segment on the right, which will allow all these muscles to move and drop that shoulder.
I actually had an injury on this shoulder. I think that's why it's elevated.
All right, and let me see. Separation. 2018. All right. Are you okay if we mobilize the joint? Fine. It's okay to adjust.
Yes.
And headaches on the right side?
Left side.
Okay. Where exactly?
Like towards the top of my head right here.
Okay. Does it go into the side? Anything into the eyeball?
Just up here, not into the eyeball.
Okay. So like I said, just like the nerves, the muscles or the body is a map. Is that tender?
Yes.
Is that recreating your headache?
Not as much.
Okay. Anything on this?
No.
Okay. So what I'm doing is I'm trying to find trigger points, which are like little pea-sized adhesions. How's that one?
It feels good.
I'm trying to recreate your headache. So any of these spots actually shooting in that pattern?
No, not right now.
Okay. Anything here?
No.
Okay. And then I just want to get in right in there. How's that one?
That's good.
Okay. Any shooting pain up?
No.
Okay. So especially with headaches, there's different causes to it. Most common that I see is musculogenic. So muscles in this region can refer headaches, and hence the trigger points. They're pea-sized shaped adhesions, scar tissue, if you will. And then when you push on it, it will not be painful in the segment or area I'm actually putting pressure. The pain refers, and muscles in this region up here all refer to the head. So if a patient comes in with a headache kind of focused around the eye, I kind of know which muscle groups I'm going to target. So we're going to take care of him just like he was able to take care of us and allow us the freedom, brother. All right, so we're going to start you on some stems right now. Okay, so let's go face down. We're going to give you a full body. How's the ankle?
It's good. It just cracks.
Is it okay to adjust?
Yeah.
Because of your service, I'm just gonna throw in a full body adjustment if you're okay with it. Just head to toe. I'm gonna align everything. Okay, Miguel. Okay. I'm gonna see you after. All right. They're gonna do stems, some muscle work. I'm gonna have Artin come back and work on the muscles to get rid of your headache, and then I'll come in, decompress and adjust.
Thank you.
Yep.
Take me back to a place where I felt at home. Take me back to a day when we weren't alone. Take me back to an age when the world felt small. Way back before we blew it all. Take me back to a place where I felt at home. Take me back to a day when we weren't alone. Take me back to an age when the world felt small. Way back before we blew it all. Too many things going on, I can't keep track of them all. From people dropping a bomb to people putting up walls, I feel like life is on hold, perception stuck in a vault. I know that time can heal all, but how much time till we fall? It's awfully chilly outside when there's no shelter to hide. When everything is a lie, you'll find that out in some time. But when the things on your mind are all considered a crime, communication aside, we'll all just fight till we die. Is this an argument or just the start of it? Either way, I don't wanna be a part of it. Can I just get some space? I don't have the heart for this. I can't be picking up the pieces, fixing scars from this. Is this an argument?
So we got some muscle work done. We started with stems, a little bit of heat just to warm up the muscles, relax them, get the blood flowing, and then we had Artin do some manual trigger point therapy on the musculature, the muscle groups that were reasons for his headache symptoms. Okay, and now we're ready to decompress his spine, his low back, just to mobilize it, relieve the pressure, and get him to a state of wellness. All right. Before we do that, you could tell by the line on the pant seam, you see how it's shifted to the left gluteal region. That's a tell that that side is actually not moving. So in turn, if we just check out his leg length right now, you could tell a significant difference in length when compared to the left side. Okay, and again, that's not that his physical leg is short. I'm gonna place my hands and palpate like the sacral segment. Okay, this low back region. You okay with that?
Yes.
Okay. It's actually due to a shift, which is pretty significant. This should actually be lined up when I palpate them. So the right joint is here, the left is here, and this is the SI joint, sacral, sacrum, and ilium, okay? That's the joint you actually sit on. Those are the dimples in the back, and then when we actually lift to sit, that comes to the bottom. So we sit on it. So very likely he's favoring putting more pressure on the right glute when sitting. And I'm sure you've noticed when you drive, you just don't feel even in the chair or seat. Do you ever shift around?
Yeah, I'm mostly on my right side.
So pay attention to see if that's taken care of after our visit, all right? I'm gonna tie your legs, buddy. I ask you not to scooch down once I stretch your back, all right? And we're gonna communicate throughout the whole treatment. So I'm gonna stretch your legs right here. All right, and we're gonna start the decompression process. All right. Have you ever received spinal decompression therapy?
No, I haven't.
All right. So I ask you to be relaxed. Just relax your neck too, okay? So I'm gonna show you what movement we're gonna go through. So your spine or your back, we're gonna have you go through a pumping motion like this, okay?
Okay.
Nothing too intense. The only difference now is I'm gonna place my hand on your spine levels, okay? As I do it. Permission to expose your back?
Yes.
Okay. Let's try to get some skin calves while we're at it, huh? There we go, good. Good. All right. So when I do this, this should line up with the L4. All right, I'm gonna pull just a little bit just to get to the base. And this is L5S1 space right there. Tender?
No.
All right. Breathe in. All the way out. Doesn't feel too bad. Just a little right when I get to this one. Right here. How you feeling?
Good.
Is this more tender than the level right before this?
Yes.
Yeah. So this is L4. It's the most commonly injured when it comes to disc injuries, because in the low back, there's obviously a curve. So the L4 level is kind of near that apex of the curve, which makes it more susceptible to injury. Obviously, how does this feel compared to the two before?
Yeah, it hurts a little more.
More?
Yeah.
Okay. So with chiropractic, you know, your hands are your eyes, so you gotta feel everything. So I'm gonna do the same thing, just stretch you a little more, and I'm gonna switch up just so I could change the muscle groups on myself, okay?
Okay.
Breathe in. All the way out. Nice, okay. You'll definitely feel the stretch now, buddy.
Yes.
I'm not gonna focus on this level too much because it wasn't the worst. All right, it starts right here, correct?
Yes.
Yeah, so we're at L4. About 5 now. Now this is where we had the more restriction. There we go. Breathe in, out. There we go. Just breathe. Whew. Good. An interesting fact, those discs, if you remove them and pile them on top of each other, they create 25% of our height. So one of the reasons that we shrink or get shorter as we age is because when we get older, those discs dry up, they get injured, they get decreased in size, and that's the reason we get shorter as we age, because of the discs. Okay, so a lot of patients, after we treat them one time or a few sessions, they'll actually say, oh, after I got treatment, I went and I sat in the car and I had to readjust my seat a little more back, and that's because they regained, I'm not talking about inches, but obviously millimeters in height. So some cool fact, actually. All right. Because I'm gonna hook you up with a full body, Miguel, I'm gonna take you to a different table because this is a decompression table. It's not really meant to adjust on. So just to keep the longevity of this table, we're gonna just move you to another room, okay?
Okay.
All right. All right, come up slowly. So we're gonna take you to a room using drops and whatnot. All right, let's just have you go here, okay? And then give me a second. We're gonna actually give him a axial adjustment. So we call it like a Y strap and stuff like that. All right, so you've been adjusted. The lighting's okay for your eyes?
Yeah.
All right, I'm gonna start with your hands, okay?
Okay.
So we don't crack bones, right? We don't align bones, we align joints, okay? So that pop you hear is just uneven pressure being released. It shouldn't hurt, right? The more pressure, like shaking a Coke can, right? The more pressure, the louder the pop.
Yeah.
Okay? In the thoracic spine, that's where a lot of like emotions are stored. One second. You ready? I like this technique because now I could actually assess and adjust the ribs at the same time. Deep breath in, all the way out. Good. Okay, another fact, look. You're gonna be able to open up or hug yourself a lot more once I mobilize all this. Breathe in, all the way out. Drop shoulder. There it is. Nice. Nice. You ready, buddy?
Yeah.
Breathe in, all the way out. Drop shoulders back. Good. All right. You stop hugging yourself if yeah. I like to adjust while the leg is rested. That way the hip joints or muscles could be relaxed. And most of the time I get both the hip and ankle at the same time. Which ankle was the one injured?
This one.
There's no screws or plates crossing the joints, right? All right, so we got something going on here. Let it go. Good. Good. Awesome. Let's go on your side, face me. So this is another low back adjustment, which we couldn't do on the previous patient due to the disc injury being more acute or hot or in a flared up state. Okay. Take a breath in, all the way out. Good. That's it. One more. Other side. Oh, this one's stuck. Relax the hip. Relax the hip. There we go. I'm gonna hold it there for a second, okay?
Okay.
That pop already?
Yeah.
That's a sign of a good setup. Right. Breathe in. All the way out. Good. One more. Breathe in. Out. Perfect. Now let's go face down so I can show everybody what we corrected. Perfect. So that's what we do here. We align joints because the whole body is a closed chain, a closed system. So a shift in the pelvis indirectly could cause ankle pain, knee pain, low back pain, you know. So the power of the body, you know. So let's go face up. We're gonna do an axial adjustment. Scoot down a little bit, buddy. Have you seen it where I pull the neck?
Yes, I have.
Okay. All right, you ready for that?
Yeah.
Okay, so I just ask, make sure you're not biting your tongue, okay? Once I'm stretching you, I'm gonna ask you, how's the pressure? Do you feel good, okay? Don't answer with yes or no nods, okay? Just either thumbs up, down, or okay?
Okay.
All right, buddy. So I just ask you to be relaxed, lift your neck up, okay? Down. I also use the Y strap, but I feel like I'm able to have more control with this, okay? Just make sure we don't choke you, okay? If you do, just, you know, do like a little wave and I'll stop and readjust, okay?
Okay.
Comfortable?
Yes.
How's that feel?
Good.
Good? You ready?
Yes.
All right. Deep breath in, all the way out. Good. Keep breathing. All the way out. How's the pressure? Good. Deep breath in, out. Good. Keep breathing. Out. Down. There we go. Deep breath in, all the way out. Wiggle your toe. Good. That's the one. Got that.
That was good.
Yeah, I know. Don't worry. Give it a second. It's an intense one. A lot of people don't know how to react, you know. But I did feel a lot of the upper back and stuff.
I felt it in my whole back.
Yeah. It may have gone all the way, but you know, my focus was here just to help get rid of the headaches. You ready to get up?
Yes.
All right. I'm gonna bring a chair actually. If you can still compare, okay. It is improved since prior to treatment, at least for me, all right? But we're gonna adjust your shoulder. So cup your ear, relax the shoulder. Okay, I'm just gonna mobilize. I don't wanna go too crazy, all right? Cup your ear. There we go, good. You ready? You want me to do your ears too?
Yeah, sure.
Cool, cool with that?
Mr. Crockett?
Yeah. Oh, you're really relaxed, buddy. Good. You ready to unleash the Kraken?
Yes.
All right, bro. Let's go. Woo! I kind of want to say that was a lot of crack. All right, brother. Now I'm gonna check for uppers too, but I know you're definitely gonna need lowers on this side. But let me just. Okay. So for you students or chiros out there, before I target the lowers, I actually need to take out the traps from the equation. So I'll actually start my slack from back here. And by the time I land here, the traps are completely pushed forward, allowing me better or a more stable contact on the TPs. Okay. Sometimes I will hold their head to stabilize the neck. Okay. Because you always need a confident contact. Jeez. Drop right shoulder. Good. All right. Give it a second. Let's compare now. Left and right. Let's see if you got that shoulder to drop. Oh, nice. There you go. Thank you again for your service.
Thank you.
Appreciate you very much, brother.
I haven't really been to a chiropractor in like over a year and a half because I just came back from deployment. and I really felt everything. He just like, I feel like a completely different man right now. It's just all the stress from being in the Marines, and yeah, it's really good. I'll definitely come again.